Hi, everyone coming in. We're just going to give it a couple minutes to make sure everyone's able to get on. All right, we're just going to go ahead and get started. This is for pre-med students. And in the session, we'll be hearing from graduate students in medical school about their experiences applying, getting into grad school, and how their program is going so far. So first, I'd like to start off by introducing our graduate student panel. So after I say your name, if you would just introduce yourself, and we'll start with Jennifer.
Hi guys, like she said, my name is Jennifer. I'm a second year student at the Kirksville College of Osteopathic Medicine. I did my undergrad in Michigan at Saginaw Valley State University, and I was a biology major and chemistry minor.
All right, Mala.
Hi everyone, my name is Mala. I currently go to Carver College of Medicine, and I'm a first year, and I went to Iowa State for my undergrad and majored in bio.
Courtney.
Hi everyone, I'm a first year student at Des Moines University, and I was a kinesiology major at Iowa State.
Josh.
Hi everyone, I'm Josh. I'm a first year medical student at University of Iowa Carver College of Medicine. I also went to Iowa State, and I also majored in kinesiology.
Natalie.
Hi, I'm Natalie. I'm also a first year student at Des Moines University, and I also went to Iowa State, and I majored in biology.
Kyle.
Hi there, everyone. I'm fairly similar to Josh and Mala. I'm also a first year medical student at University of Iowa Carver College of Medicine. I too went to Iowa State for my undergrad and actually got my degree in chemical engineering.
Anna Maria.
Hi, everyone. As you mentioned, I'm Ana Maria. I am currently a second year student at NYIT College of Osteopathic Medicine. I went to college in Chicago at Loyola University, where I got my degree in biology and minor in neuroscience.
Megan.
Hi guys, I'm Megan. I currently go to the Idaho College of Osteopathic Medicine in Boise, Idaho. I went to Coe College in Cedar Rapids for my undergrad, and I double majored in chemistry and neuroscience.
and Erin.
Hey guys, I'm also at AT Still University with Jennifer, and I'm also a second year. And I went to the University of Northern Iowa, and I double majored in business and biology.
All right, so the first question we have is, how did you prepare for your MCAT? And if a few people want to share, we can start with Megan.
Yeah, for sure. So just as like a disclaimer, I did not take a gap year. So I would say that my studying habits would have definitely changed if I did take a gap year. But I studied using the Kaplan books. That was like my main method of studying. I did not pay for a course. I know that that's something that is always kind of a hot topic with pre-meds, is whether to pay for the course or not. And I only really studied for about 8 weeks. And that's just knowing myself. I'm unable to focus on one thing for like 4 months. I just can't do it. So that's all I studied for the MCAT. I didn't do amazing, but I did good enough to get into the programs that I wanted to. So that would be what I did.
Does anyone else want to pitch in a little bit on their studying habits?
The only thing I'm going to say too, I definitely did what Megan did, but if you guys are not majoring in like the sciences, especially, I noticed a couple of you guys were in the same boat. So I was a business major and I front loaded my coursework with business classes and then biology later. And I didn't take a gap year either. And it kind of did not do well for me the first round because I was like, oh my goodness, I am doing organic chemistry and I'm learning it by myself. So hypothetically, if you're doing a secondary major, I would front load all of your science classes and then do your other major at the end. So then you can just kind of bypass that crazy hectic season and just be able to kind of have some background before taking the MCAT initially. So.
And then the next question is, what did you look for?
Really?
Oh, yeah.
I took a gap year just because they both didn't. And I bought the course because originally I tried studying for it with just the books. That didn't work out for me. So I ended up taking a gap year and doing the course. So if you have to take a gap year, if you don't, it's not really gonna matter as long as you study the way you need to get the score that you need.
Thank you. And what did you look for when selecting your graduate school? Kyle, you wanna go?
Okay, so off the start, I basically took a giant Excel spreadsheet, put all the schools I had interest in, and then put in things like GPA, MCAT, cost of tuition. Went and like Googled pictures of their campuses, figured out which campuses I like and all that kind of thing. And then I went through and kind of looked at like student organizations. Did they have things that students could be involved in terms of like volunteering? Here at Carver, we have like the mobile clinic for students that we can volunteer at, the mental health clinic, that kind of thing. Look to see what kind of resources were available to students to help them like excel academically. And then just kind of like, is there that community there was the other big thing. Is there a community that fosters like collaboration between people, doesn't have that competitive environment, and allows you to do well in medical school, because it is a challenge for anyone that gets in.
Would anyone else like to share?
I would. You go ahead.
All right, which one? So I'll be short, but I think Kyle covered like the big picture of it all. And I would say that another thing that like I emphasized, and he mentioned it as well, is when you go on oh gosh, I could not speak. When you have your interviews, pay attention to the environment at the schools. Yes, it's medical school and ultimately your goal is to get in. But if you have a chance to get a sense of how students get along, what's the environment, what's the administration like? On my interviews, I've noticed, some schools are very stern and it's like dog eat dog kind of environment. And I would not thrive in such an environment. So pay attention to that because it does make a difference. Make sure they have things available for you, such as academic advisors and people who are there to cheer you on and help you along, because it is a pretty rough beginning, especially in the first semester of med school. So you want to have a good community.
Okay, I'll be really fast, I promise. So something that I wish I had done that I did not do, I wanted to move out of Iowa. I loved my time in Iowa, but I was ready to leave. And that was really important for me. So I was looking for schools across the country, which is very different than most people. Most people kind of want to stay within where they have been. But one thing that I wish I would have done when I was looking was talk to current students of the school I work really closely with pre-meds at ICOM. So that's something that I love doing, is like talking to them about my experience and things that they may enjoy that may be different. So I would definitely recommend, if you can, to reach out to the schools and talk to current students, because I think that is really helpful.
Okay, thank you. The next question is, what are some things you did to help your application stand out? And Courtney, do you want to start?
Sure. So I'm sure you'll hear that a lot of med school applicants are very similar in what they do. Like they have very similar volunteer experiences. They all do research pretty much. So I was very involved in dance in undergrad. I was the president of a dance company. I choreographed a bunch of dances. I also did the research and the volunteer, but in my interviews, dance came up more than anything else because it was something that was different than other applicants. So they wanted to talk to me about my experience with that and what I learned from that. So if you can do something that's just kind of different, that's what I recommend.
All right. Mala, do you have anything to add?
I would just echo what Courtney just said, because like almost exactly same. I had a minor in animal science and I really love working with animals and volunteering at the animal shelter. And I kind of really talked about that and kind of made it a metaphor in my personal statement almost. And so I also got asked questions about that as well. So if you have like a unique hobby or something that just makes you different, try to incorporate that into your either personal statement or your interview questions or whatever. That'll kind of help you stick out.
Thank you. And the next question is it difficult to find scholarships to cover the cost of medical school? And I don't know if any of you have any big ones you'd like to talk about.
I can talk a little bit about how Carver does theirs right off the get-go. So basically for first-year medical students, they have like a general application where if you get accepted into Carver and you have like all your FAFSA done and applied, basically every student is enrolled for a potential like scholarship. And they basically go through, it's like a lottery system. Some of them are merit-based, but then some of them are just like distributed to all students. And so in our class, I know quite a few people that have scholarships of varying amounts. It just kind of depends. And then, like I said, there are those merit-based ones that like as you progress through medical school, once you start to build that like med school curriculum or the CV, you can like apply for those and you actually have something to back it behind. But that's kind of how Carver does theirs, is just directly through the school by filing your FAFSA. There's really no other application for them.
Is that kind of how all your schools do it?
Specifically for me, I know scholarships are just based off of how much work you want to put in. So if you, like our school sends out a link when scholarships are ready. And so if you want to go through all of the ones that they compiled together and put your application in, some of them don't require anything. Some of them want your FAFSA, some of them are merit or more personality based. So if you want a scholarship, you just have to go find it. And I think that's what really makes the difference, is how much effort you want to put into getting school paid for. I'm more on the lazy side and I don't like writing essays. So I tend not to go search for them. So if they're easy, I'll pull it out. If they're not, I kind of skip over them, but it's all the effort you want to put in.
All right, thank you. Natalie, I'll have you start with this question. And it is, what does a typical day look like for you? And are you able to find time to take care of yourself and participate in your hobbies?
Yeah, that's a great question. I would say there's not really a typical day. Classes change every day for us at Des Moines University here, but usually it's around 4 hours of lecture, then maybe like 1.5 or 2 hour lab for the day, and then the rest of the day is spent studying. I usually can get like a workout in the evening and have a few hours off in the evening as well. Here at Des Moines University, we have an exam every 2 weeks. So the weekend before that, I usually am spending studying, but the other weekends I can get some time off.
Are any of you able to balance like part-time jobs, or are you just only school?
So I work as a respite care provider, which I did for many years before med school. So I do some of that. I can find like some hours on the weekend or in the evenings. Usually the families that I work with will just reach out to me and see if I'm available, and they understand if I'm not. But it's very minimal, and I do most of it on breaks from school, but I am able to find some time during school to do some hours.
All right, thank you. And the next question is, in what ways does medical school differ from undergrad? Josh, do you want to start?
Yeah, so a big difference for medical school to undergrad is just the amount of information that you're learning. We say like one exam is pretty much like a semester's worth of information. So it's just a lot of information. It's not necessarily like super, super challenging stuff. It's just the amount of information that you get is so much. And kind of another thing is they, like the professors and everything know that you're super busy and stuff like that, and the advisors and everyone. So if you're involved with like clubs and other things, those are like really minimal time commitments, as opposed to an undergrad where you try to like join a bunch of clubs and get your like resume up. Really in medical school, like your one job is to be in medical school. So in a way that's kind of nice, but the biggest difference is definitely just the amount of information that you have to learn.
Would anyone else like to add on to that?
Yeah, I was gonna say, I think there's also less like homework or like assignments we have to do in medical school. I think literally all our classes are basically just based on the exam. So I feel like in a sense there's less busy work, but just studying for the exam takes up most of my time.
All right, Anna Maria, did you want to add on, or I thought I saw yours?
Yeah, I was gonna say I'm a non-traditional student, so I had a bit of a career meanwhile. So for me, I learned time management while doing that, but I did notice that a big challenge that some people have when they start med school and coming straight from undergrad is making that change and managing your time. It's not like we all went to undergrad, so we studied, I think all pre-med studied pretty hard, but it is just a different, like you are taking it to the next level in med school. So time management, if there is something that you could work on in kind of building your stamina, is very important. I think that's one of the biggest challenges that a lot of med school students have beginning, especially the first semester, just because you are studying for 12 hours a day and it takes some stamina to do that.
All right, thank you. The next question is, are any of you involved in research? And if so, how did you go about finding the opportunity?
I can just kind of talk about what Carver does. So you have a gap after your M1 year. So we end in May and then you start again in August. And they have a program. It's like basically research in the summer. And there's an application that goes with that. And you just kind of find a mentor. They have like a mentor database and stuff like that. Like the doctors at a university hospital are like very interested in research. So it's really easy to get connected to a doctor who's interested in like the specialty that you want to go into. So we just kind of reach out to them, and then you end up doing like a project with them over the summer, like 10 or 12 weeks or whatever you want to do. And then you end up presenting at like a conference the next fall semester. So that's typically what people do at Carver. And then during like your third and fourth year, you can do like a research block that's like 4 or 6 weeks. So if you're really interested in research, there's definitely ways to get involved. I know a lot of people don't really do a ton of research during their like M1s and 2 years during like the semester, but especially during the summer, there's a lot of available opportunities.
Thank you. The next question is, how did you find community among your fellow students? Erin, do you want to answer that one?
I thought it was just really, I thought it was a cool change. So college, I don't know about you guys personally, but like pre-meds, I feel like everybody was kind of uptight. We all wanted to get into med school. We were all going like a million miles a minute working. Like you have to be the perfect applicant, you know? But when you came here, I feel like it was just like a natural change. And I feel like a lot of people are in that same boat, but everybody is in the absolute ringer. like med school isn't exactly the easiest thing you'll ever go through, but I feel like everybody's just kind of united behind that. So like our class, I've never heard of this. We have 170 people in our class and we have this group me and everybody just randomly messages from like the most hilarious like memes right before a test, or we'll all like just talk like normal humans and be like, hey, here's some resources. I'm going to help you out for the exam. Hey, you help me out for the exam. And it's a really cool change. Everybody's supporting each other. It's you get through it together. You don't want anybody to fall behind. So
Anyone else?
That's really funny you said that, Erin, because ICOM, we have the same thing. We have a group me for our whole class and we have 160 students, so similar. But I think that something that was really important for me, especially because I moved kind of across the country to go to med school, I just found people that had similar interests as me. And I mean, we're all interested in medicine, we're all in med school, but outside of medicine. So like, I'm really into playing sports on my free time or planning like weekend trips. There's a ton of wineries in Idaho. So like, that's something that we do once in a while. But I think just finding people that share your interests that are not medically related is really important because it gives you an outlet outside of the classroom. So yeah.
Thank you. What is the one thing that you could change if you could go back to your undergrad that would help you where you are now? Jennifer, do you have one?
Something I would change that helped me where I am now. I don't know if it would help me exactly where I am now. I wish I would have done more of the like study abroad trips and just spending my time that I didn't think I had time in undergrad. You have a lot of time in undergrad. You don't realize it. You have a lot of time. And so just spending more time like with the friends, going out and doing things that I pushed off, I think that would have benefited me because I wouldn't regret it now, knowing that I don't have time to do it. So I guess I was looking back, I wish I would have done some of those things that I pushed off a little bit.
I would say just like having good study habits from the get-go. I think in undergrad, like classes aren't typically that hard. There's definitely not as much volume as in medical school. So you can kind of get away with procrastinating until the day before or 2 days before the exam. And you cannot do that in medical school at all. So just like had I been a little bit better about not like figuring out better study strategies from the get-go would have been nice.
Great, thank you. How many semesters can you expect to spend at graduate school, and around how many credits do you take each semester?
I can speak about Carver real quick. So in terms of the way the curriculum's set up at Carver, it's 3 semesters of pre-clinicals, which is going to be like all your coursework learning, your like pathology, your diseases, social disparities of health, that kind of thing. That's all built into 3 semesters. You got some early clinical experience there. And then the remaining 5 semesters are all going to be your rotation. So you have a year of core clerkships that everyone cycles through, like your internal med, your OB, your pediatrics, all that. And then kind of that last year, like Josh mentioned, you kind of like get to pick your block. So if you're interested in research, you can do that. If you're interested in like radiology, you can go do that. And so it kind of gives you a little more freedom and structure there. Now, as for credits, I think our first semester was 25 credits or 26 like that. And then the second semester, I know for sure, is 26 credits.
Yeah, I can speak about Des Moines University. So we do like a 2+2 program. So we have 2 years of classes, which I think is similar credit load. You can correct me if I'm wrong, Courtney, but around 25 credits. And then we have 2 years of rotations. That first year is the general rotations, and 4th year, you kind of get to pick what you want to do as well.
I'm gonna throw like one note in. So especially, I didn't really know this before, like my friends started like separating between like DO and MD, but like at least our program, we have an ultrasound lab too, which is kind of cool. And then we do a lot of OMT hours. So if you guys are going the osteopathic medicine route, make sure you look into that. Like how big do you want to be into this like hands-on care versus like ultrasound versus anatomy versus research. So like I know osteopathic doesn't have a lot of research opportunities unless you personally like ask the professors and whatnot. But then our course load kind of changes. So like the first year, we kind of front load all of our courses because we're doing like, I think we had like a 35 credit one time, and it was not fun, but it was because it was front loaded with like OMT and anatomy and everything. And they try to do it like systems based, which is really cool. And then the second year, they kind of ease you off into the systems, and then they kind of like fine tune your motor skills, which is cool. And then kind of like what Natalie just said. So then the last 2 years are just going into the clinicals. So it's just kind of make sure it's not necessarily like credit wise you have to look at, but make sure you know kind of which field you want to go into and what you want to emphasize in medical school too.
Thank you. And it looks like we have a question in the chat. It says, what are some good study tips you have for undergrads? So anyone can go ahead and answer that.
Something I find really helpful is to make like my own summary like notes about lectures, and really try to like condense the information, because that like makes you think about like the main points yourself and makes you kind of engage with the material more. And so it's something I find really helpful.
I can add something to that as well, and I echo what Natalie said. When we started med school, a lot of people were telling us, oh, you're gonna have to let go of all your undergrad study habits. Well, it depends what study habits you had. Like, I strongly recommend that when you study, you try to understand. So draw it out, summarize it, read the textbook, and not in the sense of like, oh, I'm gonna memorize everything that's in this chapter, but read where you are not clear onto why is this process, why is it happening, like, so that you understand. And like, if you understand, you better remember and are able to connect things, because like in med school, there's yes a lot of memorization to a certain extent, but then it comes a point where you have to put all these things together. So being able to do that is very important, and to do that you have to understand, not just memorize. So that's something that I strongly value, just understanding why something is so.
Thank you. The next question is, what advice do you have for obtaining letters of recommendations, and how are you able to connect with your professors on a more personal level? Megan, do you want to answer that one?
So my experience was a little bit different because I went to a really small school. My graduating class at Co was under 300 people, so we had a really small school. But my biggest advice for getting letters of recommendation would be to ask early. I had friends that were trying to apply to medical school, and they were still asking for letters of rec like in early October, late September, which is really late. I don't know how you guys are in your medical school application kind of timeline, but that's pretty late. And then they were getting people who were like, oh, I'm really busy, I can't write this. And then they didn't have enough recommendations. So I would say asking early is a big thing. And then also something that I did that I really think worked well for me was I would just go up to where our faculty's offices were, and I would just sit there and talk to them for like maybe 10-15 minutes after class or something. It doesn't have to be about school, it doesn't have to be about academic, but just so they know your face. So when you ask them for a letter of recommendation, it's not just, oh, this one student that I had one time and maybe this one class. It's, oh, it's Megan who comes to talk to me and she's from Colorado and stuff like that. So I think that would be my biggest advice.
Yeah, this is definitely something that can be hard at Iowa State. For me, especially it was. And definitely, if you like a professor for a class, like go to their office hours, and like Megan said, just like make sure that they know your face and they know you. And I even like went to office hours and asked a question once, even though I thought I like understood it, just so I could have that extra interaction with the professor. I think that's important.
And just to throw in, everyone, like obviously you're here, so you're thinking about medical school, so that's great. If you're even earlier in your undergrad, that's even better. I didn't think about it too much. I knew I needed them, but I didn't know where I wanted to go to school, so I didn't look into the schools. Some schools are very specific about what kind of letters you need. So if you have an idea of kind of where you might want to apply, or where you like you might want to be up, DO, MD, things like that, maybe start looking into one letters. Because when I needed a letter, finding a non-science faculty to write me a letter was just not going to happen. Or Some want a specific DO doctor letter or a specific MD doctor letter. So knowing who you need to get letters for and who you need to start building relationships with is really important.
I would add something really quick. Just try and be present and answer questions in classes. Like if you have a gist that, hey, I think, I'm going to do well in this class and I enjoy this subject, be involved, answer questions. Professors remember, I remember in undergrad, a lot of times people would be like a little shy to answer questions. So that's another way you can, pop up, like answer the questions, go to the office hours. Depending on the courses, I remember there were discussion hours where you would go to the Blackboard and answer questions and so on. So that's another way like that professor sees you involved, and then the people you may want to do research with. And a lot of schools, I think the pre-med programs are pretty strong where they have committees and advisors. Definitely use those people. I did not. That's one thing I regret. I wish I had used those resources better, because they have a lot of great advice for you, and if you follow that, generally, they know what they're doing.
Thank you. And the next question is, what are some tips for preparing for interviews with professional schools? Courtney, do you want to start?
Sure. So at Iowa State, I actually set up some appointments with career services to do some mock interviews. That was really helpful. But I remember the one time that I went, the person that was doing it was like, I actually have never really heard of a DO program before. I don't know what kinds of questions they would ask. And all of my DO fellows here would know that you get asked about DO, like why you want to be DO. So I actually reached out to a professor who used to teach at a DO program, and he was really, really nice. And he let me come in and he asked me questions and gave me feedback and stuff. So if you know people in the area that you're interested in going to, definitely reach out to them, see if they're willing to, maybe you read your personal statement, and then maybe they'll ask you questions about it, and that will kind of prep you for your interview.
And
Was somebody else going?
you go ahead.
Okay. So this is I know, really controversial. I don't go on SDN, but if you do, definitely check out the interview section of your whatever school you're gonna interview at, because typically they'll put what questions were asked historically, and so you can kind of get a sense of what they're gonna ask, and if you take those and think of answers already that how you want to answer it, I think that'll be helpful. I will say the couple schools I interviewed at, they definitely asked some of the questions that were on SDN. So definitely look into that. But for nothing else, don't go on SDN except for interview questions.
And then I had one more thing too. I had one interview. She only asked me, so it was like a 45-minute time slot, and she only asked me one question. And so I was like, oh my goodness, you've prepared for okay, she's gonna ask me this. But I seriously think it was just to see how well you could talk, So we ended up she asked about leadership or whatever, and I answered that for 5 minutes. And then we just sat there and talked about bullying and her kids and what she's doing afterward. And I seriously think that's to see how personable you are. Cause physicians, you're obviously gonna have to talk to people. So just, be able to keep a conversation.
So at my interview for ICOM, I always like to share this story because I think we expect our interviews to go well all the time. My interview at ICOM didn't go that great. And I know that because my very first, so they do mini interviews. I'm sure you guys are familiar with those. So you do with 3 or 4 different people in 10 or 15 minutes time slots. It's my very first one. The first thing that he said to me, he's like, well, I've never heard of your school. I was like, yeah, fair. And then he's like, well, why did you get a C in OChem? And I was like, because it's hard. It just is. So it's okay if you get in an interview and you're faced with that question. So I didn't go on Student Doctor Network because I didn't know it was a thing when I was an undergrad. I was oblivious, I guess. But I Googled medical school interview questions, and I printed off like 15 of them, and I would just typed out answers to everyone. So even if I didn't memorize it, I would just know like kind of what I wanted to talk about. And one thing that I found when I was Googling is that when in doubt, get the interviewer to start talking about themselves and what they're interested in. So like when he was talking to me about how I like didn't do great in OChem, I was like, oh, well, what do you like about OChem? So that's just a good trick, is just kind of, if you're stuck, ask questions, because it makes you seem really interested, and it also gives them a chance to talk about the school and what they love to do, which is teach.
Thank you. What has kept you all motivated throughout the rigorous process of like your application cycle and then like your first year at school? How have you been able to stay motivated? And anyone can go ahead and answer that.
I'll just say one thing because I'm in my second year here. So first year is rough. I'm just telling everyone, whether you're in first year or not, first year is rough. And especially with COVID, it has been lonely and horrible to be in COVID restrictions for a year. So keeping me going, my lovely trusty sidekick keeps me going. And then friends, your classmates are going through the exact same thing you are. So having people to talk to about that one teacher you don't like because they never give any hints, or how hard or bad you just bombed a test, is super helpful. And then being able to call my family who doesn't talk about medical school to tell them, because they're going to side with me no matter what I say. So telling them how stressed you are, how tired you are, is also just a great resource. So having people around, or animals or other people around that understand or are just willing to listen to you, is a great resource, and lets me know that I know that I got into this for a reason and I can probably do it all.
I think another thing for me is just like going into the clinic and having clinical experiences, or like observing a doctor like do a surgery or treat a patient or something like that. That just like kind of shows you the light at the end of the tunnel, and you're like, this is like where I eventually want to be. And like you just kind of see the big picture, and you're like, okay, like I just got to get through, the next couple years, and then I'm going to end up like being able to like treat patients and take care of patients. And that always like just kind of rejuvenates me, and it's like, okay, like this is why I want to do this. Like, this is an awesome profession. And that just kind of rejuvenates me for school. So that's kind of my thing.
Kind of similar to that. So as a medical student, you get free memberships to a lot of professional organizations. So I recommend definitely taking advantage of those, because they put on a lot of really cool webinars, and it's a great way to network with doctors in fields that you're interested in or thinking about. And just talking to people has really motivated me, because it's like, wow, like I want to be where they are, and they're willing to help you along the way, and they understand what you're going through. So that's been a huge motivating factor for me.
I would also say, like, if you have a hobby now, definitely try to cut out time, maybe once a week or once every 2 weeks or something, to spend like an hour on that hobby. Because I know like a group of my friends will watch The Bachelorette like after every exam, and we have exams every 2 weeks. So that's a really good way to like hang out with your friends, like everybody else has said, and then also B, just take time away from doing medical stuff or like medical school. Another thing that I think I just started thinking about was like, don't try to think too far ahead. Like, I really just take it maybe 1 or 2 weeks at a time, just till the next exam. I think when you think about like all the things you have to do, like boards, research, residency, all that stuff can get super overwhelming really quickly. So if you just kind of take time, just think about like 1 week ahead or 2 weeks ahead, whatever, it does make it more manageable, in my opinion.
All right, the next question is, what inspired your journey? Or is there like a defining moment where you knew like medicine is what you wanted to go into? Josh, is there something?
Really the first time, like I kind of went into undergrad wanting to go into medicine, just kind of always had an interest in that. But I shadowed an orthopedic surgeon my freshman year of college, and just like, I saw like total hips and total knee surgeries, and just like, cranking out the bone saws and taking off the femur and stuff like that. And I just sat there and I'm like, this is like the coolest thing I've ever seen in my entire life. And I'm like, I want to be like the person who's in the operating room, like saving people's lives and improving people's lives. And that was the one point where I was like, this is 100% what I want to do.
So I can add. So for me, my journey is a little bit different than most people, I would say, in my class, as in the fact that I've always wanted to be a DO. So when I was in 4th grade, I was diagnosed with Graves' disease. And then I also went on a field trip to Des Moines University and learned what osteopathic medicine was. And so I had decided at that point I wanted to be a DO. I didn't understand that there was a difference between MDs and DOs or whatever. But I got really interested in OMM then. And so my path since then has just always been DO, which is very different than most people. But if you're interested in DO and OMM, like definitely look at different schools, because a lot of schools do it differently and they have a lot of different hours and stuff. So check out different schools.
Thank you. And the next question is about shadowing. How do you go about finding a physician to shadow? Do you email them? Things like that. Kyle, do you want to answer this one?
Yeah, I can. Okay, so kind of a background. No one in my family or family friends is in medicine. I'm like kind of the first one to like pursue anything, and that's like nursing, physician, PT, anything like that. So I had like no family contacts or friends whatsoever that I could just reach out and be like, hey, can I shadow? So I resorted to the old daunting method of sending emails to physicians and was like, hey, here's another undergrad student. I'm trying to get shadow hours for medical school. And most physicians are pretty nice. Some of them like, so in Ames, for all you Iowa Staters, it's difficult because Mary Greeley does not like letting students shadow for the most part. Unless you have a personal connection with that doctor, it's pretty difficult. But if you travel down to Des Moines, it's like half an hour away, or have contacts back home, that kind of thing. If you reach out, a lot of them will be like, yeah, for sure, come in and get a couple hours. And the one thing I will say is keep it diverse. You don't want like 40 hours in family medicine and then nothing else, because that really doesn't show you much of medicine if you're focused on one specialty the entire time. So for example, like if I broke apart my shadowing, I had dentistry in there for a bit, oral surgery, I had family med, anesthesiology, surgery, orthopedics, OB. So the more that you can like basically talk about in your interview, the better. So yes, stick to the emails is what I would say.
I specifically didn't have a lot of shadowing hours because, like you said, I'm the first person to go into medicine. I didn't have any resources. If you do, use them. Or if you can, that's how you get away in this world. You use what you got. But I didn't have any. So getting shadowing hours was really hard for me. So I maybe shadowed one surgeon. And then after that, I chose to become a scribe in the emergency room, saw everything. Everyone wanted to talk about it. It's the best way to get free or shadowing hours where you get paid, honestly. But other than that, I made sure like I volunteered at the VA hospital. I volunteered in hospice care. So I wasn't necessarily getting shadowing hours. I just continued to show that I was interested in medicine by doing something in the healthcare field. And I think that's what they're looking for. So even if you don't have a lot of shadowing hours or you can't seem to get them because doctors are busy and some of them don't want students following them around because they already have residents and medical students following them around. So if you can't get them, as long as you show that you have some interest in healthcare and that you've tried and been a part of healthcare in some way, that's what they'll want to see.
If you guys have time, I definitely echo what's being said. I encourage, I'm of similar background, like I don't have people in medicine, and if you have the opportunity, I know a lot of med school students, undergrads, you have a part-time job, or if you're gonna take a year off, look at a work opportunity where you are around healthcare. Like I had to take time off in between longer than most people, just because of my circumstances. And I worked I worked my way up into becoming like a clinic manager in an urgent care. Like you get, we had people working as medical assistants or scribes. You really get your hands on and you get to see a lot and you get to see reality of medicine. And I think that's also important, not just in terms of like preparing you to have a good application and resume, but really to understand what medicine is like, because a lot of people just, you see movies and it can, it can appear more poetic than it actually is, or vice versa. So in addition to these experiences being helpful to you there for application, they're also like kind of enlightening to making sure you know what you're getting yourself into.
I have one more thing. I'm sorry. Another really good way to get hours. I was a phlebotomist, which I had no intention of being a phlebotomist when I started undergrad, but it ended up being really cool. And one of the really cool things about being a phlebotomist, you can work in different areas of the hospital. So I would work in the ER for like a couple months, and then I would go up to like the rehab floor, and then so you got to see a lot of different types of medicine just by drawing blood, which is pretty cool. Another thing is, again, I went to a small school, so this may not apply to everyone, but our school had a program. It was called the Health Sciences Internship, and you had to apply and get accepted, and it was kind of a process. But once you were accepted, for 1 whole month in the summer, the school would set up shadowing for you. So like for a whole month, I just shadowed doctors that the school had like, I guess, connections with. So I did a neurologist, I did an emergency medicine physician, a general surgeon, and an OB. So check with your school. They might have something like that. Even if they don't have a specific program, there's probably people who know people. And again, I was the same way. I didn't know anyone in medicine. So that is a good way to maybe find some people too.
This question kind of goes off the last one, but what would you say is like a good amount of hours for a strong applicant to have? Or like the average?
One thing
Oh, Erin, go ahead.
Sorry. I was gonna say I was kind of with Jennifer over there, and like I really didn't do a lot of shadow hours. So like all props to you, man. Like that was incredible. You were just like listing everything off. I was like, wow, definitely did not do that. But no, so I was just trying to work, and then it was actually applying to where I like AT still where I got in, and I had just done like 6 hours of emergency and like 10 hours of like random like here and there like one day things. But then I was talking to this one lady, and she's like try to get at least 10 hours in whatever like the top 3 fields you're interested in. So I was like interested in like EM, family practice, and like OBGYN, and she was like just try to shoot for like 10 to 20 hours in each. So I mean, that's just from one person, but that was the only time I've ever heard that. So again, just try to get some experience somewhere, but you guys will be fine.
And I think we'll have time for one more question, and it will be, if you had to give away the most important tip or piece of advice to an aspiring pre-med student, what would it be?
Oh, I still want to start this because everyone's going to say essentially the same thing or great things. My advice would be that everyone in your class or in other classes has a different way of how they got here. And so no matter if it takes you taking your MCAT multiple times, taking it once, taking a gap year, taking multiple gap years, if you want to get into medical school, you can do it. And each story is going to be different. So just don't compare yourselves to others. If it takes you a short amount of time, if you're the youngest in your class, you'll get there and you'll be able to do it on your own time.
Yeah, you can go, Megan.
Okay, I have one too. It's equally as like inspiring. I think something that's really important to remember when you're applying is just because you get rejected from one school does not mean that you're not qualified to be a doctor. And I think that getting those rejection letters over and over, or even if you start to get interviews and you get rejected, or however it happens for you, it's really defeating. And it kind of makes you feel like, why am I spending all this money and time in something that these people don't want me? But keep your head high, because just because one school doesn't want you or they don't want you this year, that doesn't mean that you're not qualified and that you won't be a fantastic physician.
I also just thought of one more question. How many schools did you all apply to?
Helpful to learn from you guys. When you apply to private schools, if you're going to out of state, didn't realize, apply to a bunch of public schools and they only accept like 10 out of staters. So just helpful hint. And then always do like your dream school, and then always do one that you're kind of like more likely to get into. But I applied to like, I think I did 15, but again, focus on the private versus the public.
Okay, so since I was only interested in DO schools, I only had like, 30 some schools to choose from. I only applied to 4. I do not recommend that, but I did a lot of research into the schools and figured out kind of where I would like to be at. And I kind of made it okay with myself that if I didn't get in, then I would just work on my application and reapply. But I would recommend applying to more. It was a stressful application cycle, even though it all worked out in the end.
I'd recommend just doing 10, 15. Again, it depends. I think even like a lot of the pre-med advisors would advise for that. And do pay attention to where you're applying. Like if you have an amazing application, apply to Harvard. If you don't, don't waste your money. So like have the dream school, maybe just for the sake of like, hey, I applied to that school, but then just kind of look at their averages and so on. So you kind of fit into those. They pay attention to grades, unfortunately, in some schools. And at the same time, don't make it like, oh my gosh, these people won a 510 on the MCAT and I have a 508 and they're not going to take me. But kind of keep those ranges in there because it's a numbers game to a certain extent.
And kind of, go ahead, Kyle. Go ahead.
For it.
Oh, I was just going to add on, like, as we talked about earlier, like, it's really important to do your research ahead of time. So, like, I also made the Excel sheet where I had, like, the mean MCAT score, mean GPA. And the research that I found that was super helpful was the MSAR. It's put out by, like, AAMC, and they have all this information on the school. And you really kind of find, like, your sweet spot of schools. So, like, where your MCAT's kind of near the median, or your GPA is near the median. It's, like, interesting, just, like, from my perspective, like if you apply to schools where the MCAT's like way below where your MCAT was, you probably won't get an interview just because they think like if we give you an interview and we give you an acceptance, you probably won't end up going here. So like really like focus in and hone in on your sweet spot. Maybe apply to a couple of reach schools, but really just kind of know where you're at as an applicant, and that will like save you from maybe not getting in, even if you have like really good scores.
Yeah, and I'll just echo what everyone said. There's been a lot of great points so far in terms of like applying. And basically, like something personally that I dealt with is I think I applied to like 12 schools, and then I was so just kind of burnt out from that primary application and doing revisions and then getting all these secondaries. I think I only ended up doing like half of my secondary applications, A, because it's expensive, and then B, just because I was extremely tired of typing the same things for like schools over and over. And yes, you can copy and paste some of them if the questions are similar, but like even then there's like I think one school had like 14 questions on their secondary, and I saw that and I just X'd out, and I'm like, you know what, that $60 is just gone. I was like, you know what, I don't even care. So yeah, pick the schools that you actually are passionate about going to. Like think to yourself, if I got accepted here, would this be a realistic possibility of me going? And if the answer to that is maybe or no, then I would say save your money and apply to a school that you would actually see yourself attending medical school at.
Well, thank you so much. That concludes this session. Students, I hope you were able to, hope you're able to find some useful information. Grad students, we appreciate your time and thoughtful answers. And then Iowa State students, if you just want to go back to the conference website and find your next session. Thank you.